It should have us recording to the cloud. Wait, it doesn't say.
Where is everybody?
Well, Peter's on the screen here, and
Oh.
Alicia apparently has finished her term.
Correct.
So.
Oh.
It is,
And-
okay, you are recording. The meeting is
Who's finished?
being recorded.
Alicia.
Thank you, Director Beth.
Okay.
Jen is just not here.
Good morning.
Oh, there's Janet Fons. Hi, Janet.
Good morning. Thank you all for attending. My name is Harrison Pierce. I'm the Chair of Health and Human Services Commission.
In a bad spot.
We do have a request for an addition to the agenda. Mr. Jim Lesher, Commissioner, could you just define the agenda item that you want?
Oh, we want to get the commission's approval once again to submit grant proposals to the big innovations in healthcare and human services in town, the Waveney Telemed program and the New Canaan Urgent Assessment Program with Silver Hill. We submitted last year with approval of the commission. We seek your approval to use the town, or use the commission support for the town to resubmit these applications. Will look relatively like the ones that we submitted before, but we have now some updated information. And we are late getting it to the agenda because the lady at Silver Hill was ill for the last couple of weeks, so we couldn't make the date. But it's something we'll seek your approval for.
I think the commission, I will have an open discussion on the urgent care center, but I'll have to recuse myself with any discussion related to Waverly.
Do we need to approve the added item to the agenda?
All those in favor of Jim's motion, or Jim's addition to the agenda?
Aye.
Aye.
Then we talk
And
about
what
it.
is?
We'll deal with that further down the line.
Just before we start talking about it.
Okay, first item on the agenda, approval of the January 4th, 2023 minutes.
I move they be approved.
Any questions, corrections,
No,
I
that's
move-
it.
motion to approve?
I move for second.
Aye.
Second.
All in favor? Aye.
Aye.
Next item, reports, Health Department.
So, Jen Eielson, Director of Health. So we continue with vaccinations, obviously they're much lower for January. I provided you all the respiratory data charts from the state for statewide data. Not really a surprise that the respiratory viruses after the holidays are still circulating and up. Environmental health, building permits are still holding strong. Restaurant inspections are still busy as well. The temporary event permits are down, and that's partially because of Waveney didn't book a lot of things because the elevator was supposed to be getting done. Now it's not getting done, so there's no events there until April.
Waveney House. Sorry.
Yeah, Waveney House, yes. So that's why those numbers are down. We do have a new food service establishment that we reviewed the plan for called Spice and Tea Exchange. We also did a new salon review of intentional self-aesthetics. The FEP grant,
That's for Tom.
the FEP grant, the monthly series with the state continues. On capabilities 4 and 6. Capability 4 is emergency public information in the morning, and capability 6 is information sharing. The immunization grant, the RFP was done. It was posted on the town website, sent to all media. It ends today at 2 o'clock. I've received 5 different proposals so far, so we'll see how that goes. It's 100% funded by the CDC, not a penny from the town of New Canaan, just so we're clear on that. As part of the immunization grant. Community health updates. We continue with the QPR trainings. We did 2 in January. One was full and the other was almost full with 13. The next one's scheduled for February 16th, so that's a date change from the report I submitted to you. And we got monthly dates now from the library going forward till June. So that's good news. Continue with the diabetes, blood sugar screenings at LAPM every 2 weeks. We've added the schoolhouse apartments once a month. The Staying Put hydration seminar went well. Thank you to Staying Put for sponsoring the luncheon part of it. We had 24 attendees on that. We have another seminar this Friday about the topic is regarding sleep. It is American Heart Healthy Month, so it's one of the ways for better health. We are doing a Heart Healthy event at the Schoolhouse Apartments on February 14th with a Valentine's Day brunch, but the brunch is paid for by Schoolhouse, not by us. We have confirmed the childhood food allergy awareness training that we're going to be doing with Dr. Jamie Ruskowski of Comprehensive Care and our nurse Ellen for March 8th at New Canaan Library. The New Canaan Library will help us by sending out through their listserv registration. And I've also created a community health tab on our website to post this stuff. And obviously I send it on our Facebook page. We also are going to be doing another skin cancer screening with Dr. El DeMole. And that would be towards the end of April, and because that's National Cancer Control Month, and that will be done at the schoolhouse. The data charts, as you see, they're all there. The suicidal ideation and ODs. There is a new one been added called community violence, and that's associated again with only emergency rooms. Violence of reports. We don't get any other data of if it's a domestic violence, or what the exact details are, but just another data point for everybody that loves, data.
For those that do look at it, what happened on December 11th? I mean, December 11th, if you look at all the data that's produced, it's an increase in everything popped up on that same day. Was there any rationale for that at all?
No.
No. Okay.
It doesn't give you the.
Is it finals week at school or anything?
I don't think so, because they go usually right up to like the 20th.
Darkest time of the year.
Yeah. Okay.
It's been
I
raining
don't know.
Monday.
I mean, you look at the overdoses, you look at suicidal ideation, you look at everything. December 11th. It's
Maybe they just reported.
It could be a reporting delay, because the hospitals do delay in reporting. Like we have a
Okay.
meningitis case right now, and it was delayed by 2 days being reported from the hospital to the state, and the state calling us.
okay.
So
So it could have been a weekend or
Yeah.
something reported on Monday. Okay.
What age group is the meningitis case?
it's an elderly person. I can't get too many specifics, but yeah, that delay is critical because obviously we have to do the contact tracing and all that. So
Do we know the cause?
I don't really want to get
No,
into
no,
it.
I mean, just the viral, bacterial.
Bacterial. Yes.
I have a
Jim?
question on your, going back to the front of your report, Commissioner Lister, by the way. COVID stuck its head out once again. The fact that the case rate is down, does that mean that the trend line is forecast to stay down? My first question.
Well, you got to remember, again, most of COVID is home testing. So that data hasn't been accurate forever, except the hospitalizations.
Okay. Second thing is, do we know, or do they keep track at the state level of how many people got inoculations for COVID? We
Yeah.
also got it because it's 70 and up is a major.
The state tracks that data and it's provided on the CDC website. But it's low nationwide for every age group.
Well, because I know a number of seniors, of course, none of my intelligent peers would not get inoculated, but fundamentally, a number of people said, I'm not going to take another shot. And then when we get to Paxlovid as an antidote, a number of seniors are saying, I'm not going to do that because it gives me a bad reaction or whatever. And I said, well, there's a difference between life and death is one of the reasons you do it. But is there a way of tracking that data out of the state information to find out whether it's just bad habit seniors that are the problem or whether it's.
No, vaccinations with COVID every single age group is drastically down. I mean, when you get into 4, 5, 6 shots, I mean.
That shows the importance of your immune.
And, you know, depending on your age group with your insurance, a lot of providers are not providing it anymore. And you have to pay $160, $170 in this economy. Not everybody has the extra money for things like that. And we don't get the vaccine for 18 and over for free anymore. We only get it for the under. So
I think there's two things that are going on right now. The first is, you see all the advertisements to get co-immunization, right? To have both shots at the same time. Our practice at Waveney has been not to do that because for people over the age of 65, they've had a horrible reaction to having co-immunization. So I think some of it is because of that push to have the flu vaccine and the COVID vaccine at the same time. For us, we wait 2 weeks apart. We've had no problems at all. Our vaccination rates are well over 95%. For our seniors, they've asked for it, they wanted it, and they've not had a bad reaction to it. So I think there's a lot of things going on. I think the other is that they see the symptoms of COVID being very, very mild, and COVID is here to stay. It's going to be like the influenza, it's going to be like the flu season, except it's going to be seasonal, and it's not going to be seasonal. And so it's just something that people live with. So the symptoms that we've seen out in the community have been extraordinarily mild. It has not required hospitalizations. You still see hospitalization rates statewide going up and down, but I think a lot of that has to do with people that have never been vaccinated at all or have underlying other health conditions that require them to be hospitalized. So that's what we're seeing anyway.
I think there's a vaccine fatigue out there. And a lot of physicians, unfortunately, aren't pushing the vaccine out, although they will acknowledge if you're 65 plus, then you should get it. The Paxlovid does have negative side effect because it's kind of a mineral taste that's enough to turn people off from continuing the treatment. And the other thing is a number of senior citizens are on blood thinners, et cetera. Paxlovid, you cannot take that. Well, for example, Eliquis, so it's contraindicated. So there is a milder, probably not as effective form of an antiviral that's an option for people. But my sense in the community is that there's enough COVID going on. You know, it is in-house testing, and often negative until you don't get a PCR test and it has to be positive. But and it's, you know, unless you go through that with the lab that's doing the PCR, there's no real way to have your finger on the pulse of what the incidence of COVID community is. Right, John?
Where I was headed is that if it goes back to 2,000 cases a week, whether we would send out some kind of an educational message from the town.
But Jim, it's mutated to the point where you don't go backwards. It doesn't go back to that variant. So that's not going to happen. And no, we're not going back into emergency mode with COVID at any level. Again, it's something the state has made clear for a year and a half now. It's going to be like the flu. It's like every other respiratory disease. You need to learn to live with it. If you have underlying, health conditions, then you are to take the extra precautions. Don't go to parties. Don't go to crowded places. But no, they're not going back to that emergency mode.
You said you got,
Masking, all that.
can I ask a question? You got 5 people that responded to the RFP for media support. For what kinds of things were they recommending to do?
I haven't looked at them. They've been flurrying in the last 2 days.
Yeah, okay. Just
Because the deadline's today.
Just curious based on what we're
So
saying.
Greg Riley and I will go over those.
Thank you, Jen. That's it. By the way, you did a very good job, impressive job, and Bethany too with the budget presentation. Right?
Yes. Excellent.
Leads us right into Human Services Department. Bethany.
Hi, I'm Bethany Zaro, New Canaan Human Services Director, and we'll start off with notes for, excuse me, this is our notes that happened for the month. New Canaan Behavioral Health Alliance, working closely on that in terms of a working group as well as the alliance itself. And we are in the process, we're partnering with New Canaan Community Foundation and Silver Hill Hospital in terms of having a website that will be an informational gathering area where the residents can go onto the website. And the first thing is they will be able to contact either Silver Hill or Resources to Recover to talk to a human. And the Behavioral Health Alliance, felt that this was the first initial step for someone really not knowing where to go, what to do. And there's wonderful information out there with the hub and all the mental behavioral health addiction, but you just don't know where to begin. So we want to have them talk to an individual. So we're in the process of Renew is helping us design the website, and the costs will be incurred by the foundation and Silver Hill Hospital, but Human Services will be the clearinghouse for the Alliance members submitting calendar of events, something like that, but it's going to be vetted. It's going to be vetted, but there will be no cost to the town in terms of monetary value. And the recovery, education, and applied learning for the opioid settlement, that is in the process of being launched this month. And this is once again not a medical type site. This is an educational resource. This is it. The town is, not, and understandably so, is not getting into any type of what you should be doing. This is research findings and great insight talks, things like that, to where somebody that has someone who is looking at an addiction possibility or in the process of it, it's a great resource. Once again, it's simplifying where someone can go. But talking to the attorneys, there's no liability for the town as long as we keep it away from town, the website type thing. So we will not be having it on our town website at this time at Human Services as a resource. At the same time, we will be offering it for free to the clients. We will pay them through opioid settlement. We will pay the monthly lease agreement. Donation capability. We have decided, looking at the user friendliness for donations coming in. People do not want to write checks anymore. They would like to go online. We talked to Roe at tax department, and she does have a company she uses, but cost is an issue for fiscal year 25. So we are going to delay that in terms of donations online, that topic, until another year out. It's just not appropriate for this year. The income tax assistant program, which Human Services works with every year, helping people, directing them to the library. It's a wonderful, our clients love it. It's free tax assistance for e-filing. Definitely a helpful community event that goes on between January 22nd, it's in place, to April 15th. Food Pantry was the recipient of the MLK Interfaith Council celebration, and it was great. They kindly gave us $1,300 plus the food donations. So we're always grateful once again to the community. And budget season, the PowerPoint presentation, Board of Selectmen completed, and February 8th at 8 p.m. Board of Finance will be a presentation. School health departments, there's a feasibility study possibly going for a new generator. They do have a generator, but at this point, it only provides electricity to the hallways, the commons room, refrigerator, things like that. And there's a concern about some people, they do have oxygen-based, CPAP-based medical equipment in their rooms that cannot be
Is the
covered.
HVAC system on the generator?
I don't know. This is what the board is now learning, what the capacity is, what is needed. So that's why this feasibility, I don't have a lot of details. And then the New Canaan Beautification League is going to help upgrade their landscaping, which is nice. which is nice. Management changes are going on, but the board is doing a great job staying on top of it and involved in the process. So that's a little quiet part of New Canaan that functions really well. It's really done through HUD and the senior living management for the state. But at the same time, the town does own the property. So, and I'm on the board as a representative for the town. So this is the structure. January meetings, you can see, you know, there's always one or more of these meetings every night, right? And if you have any questions, you know, the schoolhouse quarterly meeting, Silver Hill, I'm in the community, trying to, you know, making sure that the town does have a pulse on the human services aspect. Our referrals assistance and topics, people are calling in. I take the calls when I can, but the caseworkers really focus on that. And Marcy and Jackie with their caseloads, they increased by a couple from last month, and they're doing their caseload. These are new cases, new reports, new situations that are added on to their already occurring situations. The food pantry attendance, it's in relation to our client base. It has increased, but even more so. You can see that clients served in January, households that were fed in January of 22, 39 households, 90 individuals. 2023, 53 households, 118 individuals. That's what it equaled. And here we are, January was 96 households, 220 individuals. So it's doubled almost. Actually, yeah, it has over doubled since 2022. The state of the economy, I mention this every time, the state of the economy, the increased affordable housing, low-income housing that has been completed in New Canaan. This drives our numbers. And then we have the urgent assessment program. This is just giving you the update. I gave you the PowerPoint. If you wanted to click on it, that was given by Susanna Lewis at Silver Hill Hospital at the New Canaan Behavioral Health Alliance meeting. And so they now have added patient experience survey data, which I didn't put here, but you can go on to the link and get the PowerPoint. But as we see our numbers, New Canaan, there's an optimal number of 16 slots that we have a month. And we seem to be dealing between 4 to 19 cases a month since this was launched in July 7th, 2022.
It's about an average of 10 per month.
10 per month.
Yeah, I was surprised they're defining that as 16 slots for New Canaan, 4 for Weston. Is that it?
In terms of the
max
monetary,
number?
yes.
Is that a max?
Well, the thing is, theoretically, 16 and 4. I mean, if they get 6 and we get 8, you know what I'm saying? It doesn't stop at 4 slots per month, but this is what they are.
Is it budget or max?
Estimation.
Do you know if it's a budget or a maximum?
I think it's almost like they're planning their schedule with position and
It's in terms of maintaining the employees, the staff that needs to be accessible within 24 to 48 hours if someone calls for an assessment.
Yeah, I'm surprised they're putting a limit on it, if that's what that means.
It's not a limit, it's just a projection that this is what in order to maintain the staff and the cost that it takes to have this program, this is basically what.
I would recommend that we take out the word capacity, because then I think that nomenclature is misleading a little bit.
Yeah. Well, I can tell Susanna for her
Yeah.
PowerPoint.
Right.
Yeah, she
Is
said
it their word or ours?
The other question I had was the referral for the homeless parent and child. What is our referral source there?
So we contact 211 and or Department of Social Services. Jackie has to see what the situation is in terms of safety, things like that, and what their current situation is. So whatever the situation is, she will if they want, if they don't have.
We
any
don't have
relatives.
a shelter outside of
No,
New
we do
Canaan or
not.
anything that
We
that
do not, we do,
utilize.
no,
Okay.
we do not, but we get them in touch with children and families, an agency, an outside agency, where they can get a caseworker that can get them housing, seeing what their needs are.
Question, one of the things that the older adults continues to be 6 to 8%
Yes,
of the users, and one of the reasons that we want some money from AARP National is to be able to educate our seniors, because that's less than half of the seniors, and I have to know that people that are over 61 years old are under the same kind of duress and stress that the rest of the population, but I'm interested in finding out why we don't get better participation, but secondly, we could promote some education to the seniors and say, here's what's available and why you should want to do it. Maybe that could be helpful. So that's part of the reason for the grant request. But it's an ongoing concern of mine that I know that there's a lot more stress in the senior community
Yeah,
than.
I agree. It's a very sensitive subject though, and the independence and free will and respect for someone. I think that
I was gonna say the same thing, there's probably reluctance on the part
Oh,
of a lot of
there's
people to
exactly
ask
what
for
it
help.
is.
and how do you, my question is, how do you present someone like, you look like you need help?
Right,
If you need help, how-
right.
Well, look, we find
Want me
that
to do it for you?
Yeah, we do.
we know you need them. No,
Yeah,
but
I'm getting
yeah,
it.
thank you.
Thanks to you.
Thank you. We, for
Yeah.
seniors, typically it will be a child or something during the holidays that they'll come and see mom and dad and say, mom and dad, you need problems. So I think a lot of the education will have to do to the children to be able to identify within the parent that there's an
Yeah, it's a
issue.
loved one or someone that they know cares about them, that's
Exactly.
concerned.
Yeah.
It's not about come to this talk and see if you need help.
Exactly.
So I think it's a very sensitive subject, and Russ, I totally agree with you.
People need to be encouraged by a third party to seek
Right,
out.
if they're coming in from
urgent
out of town.
assessment.
sorry.
And an older person generally doesn't have a third party who's going to do that they would even accept. So it's a different animal.
Yeah, and you have to respect it, but
Does
it.
Marcy run into situations where?
Yeah, she has, in fact, and she has gently, and they have used it, the urgent assessment program, it is there, but it's, you gotta be gentle.
Sensitive, yeah.
Very sensitive. We don't want them to run away and say, well, you think something's wrong with me? Because you're talking about a stronger stigma
It's absolutely.
at this demographic level. So
Is the name urgent assessment a bit of a, is that a red flag for people? I don't
It does
know.
sound a little dramatic.
Is the name in it?
yeah, and they've gone through the name Silver Hill. I mean, it's urgent in terms of getting something done.
I could see that for parents of young. people,
Yeah,
Because it's usually a panic situation that they're seeking care.
and this is an
But with
issue.
older people,
Nationwide,
generally, not
Yeah,
often, I doubt it's as much of a panic thing as a chronic thing.
exactly. So that's why it's a gentle
Yeah.
education. It's a concern. It's this and that. Would you be interested possibly if we made an appointment? There's a way, there's an approach, and it's a lot different than a parent with a child. So we have to be sensitive to that, yeah. Any questions?
Hey, Bethany, this is Peter. Is there any programming in town for folks who have elderly parents? If they're the people who generally can really identify these things, it's obviously not direct for our elder residents, but it could be an interesting service and approach. Yeah.
Staying Put had a 6-week series, a 4-week series on, this was catered and geared towards the adult child. Yes, it is out there.
A lot of people too.
Pardon me?
That big turnout.
Huge turnout, packed. Yeah, I spoke at one of them as part of a panel. But Peter, yeah, it's there. I think it's approached very well in terms of the community. But the library is a great place to have this neutral, non-judgmental feel. But there are other, Stanford has Silver Lining. They offer us, things like that. It's about Lapham does an unbelievable job with the newsletter, events happening, not just at Lapham. So the word does get out.
There's always an opportunity if New Canaan Cares.
New Canaan
to do
Cares.
Some kind of program.
Yeah.
They would, getting those adult children, they have a great distribution list, right? So we tried that, the same.
Yeah.
That would be a way to go back and ask again.
I'm just wondering if the commission can make a statement and emphasize kind of, Bethany, everything you just said, especially that staying put thing, to say maybe they can increase the frequency of those things or something like that, because this does strike me as an ongoing issue that we've been talking about for a long time, the underutilization of the service right now. But maybe that can be as a commission, our angle and approach is just to emphasize and support those kind of programs.
Yeah, there are agencies, when they do want to have a calendar of events for the community, yes, we do suggest topics that are relevant, and yeah.
We have a lot. I mean, our community is
Waveney.
rich
What about
with
Waveney?
organizations that help this population.
Yeah,
right?
Waveney is incredible.
You got Get About, you've got, Staying Put, you've got a lot of organizations nonprofit who come in and really focus a lot of attention on this. So I think it does get cross-marketed a lot, and but we can always do better for sure. But it's that adult generation that's both really taking care of their children as well as their parent and seeing it. And I think that's where the education.
And I'll tell you what we get is we get the adult child living out of New Canaan, calling Human Services. I have one right now who's, and thank you to Waveney. The daughter knew to call Human Services, and I spoke with Russ and the nurses at visiting nursing, and we've got a great team to get this couple through a very sad time.
Yeah.
And the daughter is grateful. I mean, she's an attorney in New Jersey. She knew where to call. And this is why Human Services, it's
the
about.
It's the network.
It's the networking.
It's the network.
Yeah.
I was gonna say, if you don't live in town, it's nice that she knew to call you, but you don't know necessarily what resources are available. It's good if people do reach out.
Yeah, so it's
do that.
different doors, different avenues. I agree. They need to be all out there.
Publicized, yeah.
Yeah.
Absolutely.
People to choose from.
That's good.
What else? Waveney, we started the bereavement group, Marcy and I did, and that's been great. It's a 6-week bereavement group session at the Waveney Life Care Network Library on Farm Road.
How many people came to that?
So we had 2 this time, and we have at least, it was a bad date for a lot of people, but we have 8, 10 coming.
We have a lot of volunteers that do bereavement support through our hospice program and also home care.
So it's working. We're getting it in there, and it's getting on the calendars and into the Waveney Network resources. So yeah, we're getting there, but it's great. Anything else?
Thank you, Bethany.
Yes.
I'm just going to officially welcome Deanna Carlson here.
Wow.
Our first
All
select-
rise.
Please do it. Thank you for coming, and thank you for your service.
No, thank you.
That leads us into old business.
Old business.
But Dr. Pearson, we do officer elections. Can I ask?
Yes.
Because I have to go to stay put.
Yes.
I have a presentation to stay put. So
Right, that's fine. So the selectmen, the reappointments are going to be officially deferred.
yes, sorry,
Until-
this is a hazard of being a brand new first selectman. I thought that I just got your okay. I didn't realize that your reappointments had to officially go through the Board of Selectmen. I thought it was just new appointments that had to be. So I've reached out to all the people that needed to be reappointed, and thank you all for your willingness to continue to serve. And I will have on the next agenda the official vote on the reappointment. So, but we do have a new member that we officially seated at our meeting on Tuesday. Dr. Raquel Harrison will be joining you. She's got quite a resume, so I think you'll be fortunate to have her as an addition.
Also, at the call of the first selectman, the commission has to choose a chair and a secretary. Okay, so
So if I could
we'll
ask for nominations for the office of chair for Health and Human Services Commission.
I nominate Harrison Pierce to continue his role as chairman.
Thank you.
Second.
Thank you, Tom. Do I have any further nominations? Okay, could I get a, all those in favor? Looks to be unanimous. All right, congratulations, Dr. Pierce.
Lucky guy.
do my best.
I don't know.
Tell the parents who are together.
Very talented. Yeah, and we have, and if I could get a nomination for secretary for health. She's willing.
All in-
Yeah, we should have asked if you were willing. No, we shouldn't have.
Okay, can I get all in favor?
Aye.
Unanimous.
Thank
Okay,
you, Alyssa.
congratulations.
Congratulations.
All right, and thank
Alyssa,
you
thank you
for,
for all the work you do.
yes, perfect. Okay, so I'll probably stay back here for a little longer, but then I'm gonna head out, so.
Yeah, this one we deal with grant adjustments. Yeah.
I know, I'm like, okay, I'm like, you can go to that right now. I'm happy to answer any questions. Yeah, no, I know, it's a, I mean, I've said over and over again, this is a fair, and if any of you read the New Canaan article today, it's a really tough budget season. I mean, we have a lot of embedded costs that we're gonna have to figure out, and so, you know, it's not easy, and, you know, it doesn't mean we don't value all the contributions that all the different organizations make to the health and welfare of our residents. It's just, it's a tough year. So, all right, so I'll listen, and if you have, you know, if I can.
So,
add
yes,
anything.
Yana transmitted that message, a month plus ago. She did ask for a decrease, if we could increase our grants by 50,000, so we did. We went through the list, we did have a meeting this week. We were more than accommodating because we found possibly an avenue to decrease another 25, but you all have the budgets and the grants in front of you. And you can see what we did, just going down the line. Originally, our proposals a couple of months ago was 299. And then we whittled it down to 249, 500. And then after our meeting too, we'll just go down, you can see the numbers. We're 35, we've got about kids in crisis, 96, we'll deal with that after we do this. Maintaining cares, 8,000, but they are getting an additional 10 from the opioid settlement, so they're back to 18. And did you?
Talk to Colleen Proster. They were so grateful, so kind, and so understanding, and they look forward to continuing the relationship. So it was a great meeting.
So child guidance, 2,500, domestic violence, 2,500, right down the line, Meals on Wheels, et cetera. We did not grant anything to Catholic Charities, nor Elder House, nor Community Action Western Connecticut. And as I said, after we did have speakers for all of these grant requesters over the past year. And as I said, after a few of them anyway, I wish we could give them more. But the reality is budget speaks, and we're cutting back on them. So it's just an adjustment. So be it. The other thing here, which we were able to do, I think, with New Canaan Urgent Assessment, is to reduce the grant per se from 50 to 25,000, thinking they will get 25,000 from the opioid settlement. So we're down from a 299 to 176. Our first selectman was very happy with that, and so I think we're good. Any questions about that?
I just want to make sure that we're accurate. So yeah, opioid settlement on the New Canaan urgent assessment, which made them at
Yeah, we
50.
have to, there's probably a little wiggling that has to be done. And we could adjust if we had to, if we doesn't go to urgent assessment per se, because the way they stated, they did less than 10%. That is the presenting problem. But as they go on with that, the numbers increase, with more time, et cetera. They see substance abuse is more of an issue.
And don't we also have New Canaan Community Foundation is supporting them as well in terms of fundraising? Correct.
Yeah, but that's, we're all involved in the survey, and they're going to be contributing to the survey. What they do themselves. Peter, you're on New Canaan Community Foundation. Do they do anything per se with their money to Silver Hill?
I mean, they're continuing to make, significant annual grants, and that's not changing. So
we
they,
don't know if Silver Hill is one of the recipients.
oh, no, definitely.
Well,
Bethany, we still have to confirm that money can go. So it's not officially out of the budget yet, so,
I think we can,
right, we have to confirm that opioid settlement money can go to this program. So we'll keep talking. Luckily, we have 2 more boards to go through. We didn't take it in the Board of Selectmen because at the time of our vote, we didn't have enough information to count on it. But hopefully, as we get further along in the budget cycle, we may be able to adjust it.
yeah, the addiction, it has to be addiction related, but with this urgent assessment program, I'm looking into it and the wording, and I will make it work. I will make it work.
Is there one question? Sorry.
Oh, okay. Thomas, you want to start? No, I want to ask about the Get About. It's very much funded by the town, right?
No, it's interesting. We run their payroll and everything, but it's a pass through. So
Oh, is it? Okay, that's what I was wondering.
And it's interesting because I noticed in the meeting, and a member of the community commented on Darien. Darien's a full pass through. There's no contribution by the town. It's they showed the expenses, but they didn't show the revenue.
So it's all private. It's all
It's
foundation private.
fully private.
And they
So,
have a great machine in place to raise money, but I just said.
Yes.
kind of a
But I think Get About does a lot more than the one in Darien. They
Yeah, 'cause they do-
transport a lot more people.
Yeah.
That's maybe slightly dated information, but
yeah.
And I think
Well, we
Get About
Get About
very
gets
robust.
the cost savings for the insurance, the
Right.
automobile
No, it's a
insurance,
benefit
things
for
like
a
that.
relationship
But
with
it
the
but it
town.
is a pass through. I think it should.
my question is this going to affect Get About's ability to serve people going to medical appointments? It's a pretty critical service.
In
Or
my-
not?
In my conversation, because I spoke with the chairman of the board, and, obviously they are not happy getting their budget cut, but, it is I have the understanding that they, have a good network for fundraising and a good, backstop in sort of what they have available.
And I'm looking at this, with the change of the landscape in terms of the budget this year, which we have to seriously look at, and we are. This is exactly what happens at Human Services. People come in, they don't have enough money to pay. And here we are, as a department itself, we're having to rebudget too. And this is exactly what we do all day, with people and cases and things like that. So it's a lesson, and, it even happens to the departments. So here we are, but it'll work. It'll work. Yeah, get it.
This is the outside services budget. What about the inside service for staff? Was any changes in staffing?
No, we can maintain business as usual with what we have, the staffing. As I said before, it's a resource-based department. So our goal is come in, listen, get them going to the places they need to go, because this is a huge area for unbelievable resources.
Can we use our grant writer that we have now to maybe help and assist and support some of these efforts and have them reach out?
And he does
Greg?
look, yes.
Okay.
Yeah, Greg Riley does look at a lot of the grants. Get About has a grant writer too. I mean, things like that. People are just, stepping up to the plate and wanting to keep what works in the town, but we've hit a little bump, and we're working through it. That's why the town's so good at figuring it out. So we will.
My other question was going forward, we did have a Catholic Charities Elder House in. They're going to be a little disappointed that the landscape has changed. Are we gonna change the message going forward and not invite agencies in on the theory that they're not likely to get grants? We don't wanna
Right.
take their time? Or,
Yeah, I think it would be appropriate just to send out a grant, but this has to be discussed to those that are already receiving. I don't know, this is
Right
something.
now, in terms of speakers, we're on hold, since we did have them all in. Yes, I know what you're talking about. It helps relationships, good or bad.
right,
So we will have some speakers going forward, like, next time as Kids in Crisis. So Martha's the new person at the high school. They feel very positive about her. She's only been there for roughly a month. So at some point in time, when she gets her feet wet, we'll invite her to speak. But I think for the other agencies, we're on kind of a holding pattern. And we'll see what the future brings.
Which I think is totally appropriate, but it's also very common for nonprofits to go around and speak to different groups and foundations, and sometimes you get a great grant, and that's awesome, but oftentimes they aren't able, you know,
Just get
to
awareness
make the
and-
decisions,
yeah.
and so it's not like we did something untoward to them by saying, come speak to us, and then not being able.
Well, a lot of their state grants, they're required to service our populations, regardless of whether the town gives them other money on top of that. So they have stipulations from the state, from the grants that they receive.
But just in terms of inviting them in and then not being able to give money, that's sad and disappointing, but I don't think it's treating them poorly. And I think that it's good it's so good for all of us to hear about what's going on out there. I mean, it's appropriate to hold now, but, you know, in the future.
It's
It
very
isn't a
interesting to learn
guarantee
about
of
them
anything.
for everybody, yeah.
Yeah, but
Yep.
can I just ask a quick question about where we are with Kids in Crisis? If it goes down to 96, does that mean we don't have a counselor at the middle school, or?
At this point, the commission is maintaining a high school teen talk counselor. At this-
The schools, I mean, just so you know, in their budgeting process, they have budgeted another counselor in their current year budget.
Yeah.
They have initially put in 2, but unfortunately, you know, this is what happens in government. When you have a grant-supported staff and then the grant goes away, there can't be an expectation that the town will then continue to support the salary and benefits of that individual, or for this, just the salary or the fee. Because that is a significant budget item, unfortunately, you know, I mean, if they can get state money or, you know, if there's value somewhere else, but it's just, this year, the head count is a problem. It's I mean, you all saw the headline, and we can't end up where the headline was.
No, I totally understand, just keeping an idea of what's happening and knowing what's there and what's not there. This idea
And
is,
I think
right,
there are
it's not the
other-
town's responsibility. I just think that
Yeah,
that is a hugely important thing that needs
Yeah.
fixing there. It doesn't mean the town has to pay for it. I just think that we need to have that kind of person beyond a school counselor.
And I think beyond
Just
just
based
saying,
on what's
just in
happening.
the summation is, because I know we have a time commitment, but instead of just having numbers and looking at number cuts, I think it'd be appropriate to have more of a matrix, if you will, on here are other sources, or this is what's happening at the school, or things of that nature. So we have a context. But I think having nonprofits come to us and present gives them a platform. It makes us aware, and it helps us maybe help network or make it a joint effort for another organization to come and assist it, or a grant write or something of that nature. So as grants come across my desk, it may not be appropriate for me, but I may know Kids in Crisis, and I'll shoot them and
Yeah.
say, here's a grant opportunity. And I think that's a way to have a nice, cohesive matrix.
yeah, there's a grant networking.
Yeah.
System going on, yeah.
Okay.
Yeah, Mr. Riley just joined us. He could be the cavalry that we're all going to be waiting for, right? Yeah.
I mean, listen, some great comments, and I think probably a rebalancing makes some sense, but I just think it's important to remind everybody, sadly, this is a growth area in not a good way. Over the last few years, behavioral health issues are going through the roof. Talk to anybody at the school, we all know that, but that's the overriding reality that we're dealing with. And I think New Canaan as a community and all different parts have done brilliantly to respond. But that's the big picture and context. And with technology addiction and all the issues know about, these issues are not going away. And I think they're becoming more prevalent. It's because that's the larger themes that we're dealing with. And Jen, Bethany, I'm sure you would probably, underline that. And again, I think it all makes sense. Everything we're talking about makes sense, but we do need to keep that basic truth in mind as we think about these areas.
Peter, it's interesting because I had this conversation, I think Barb might have been there at the library. We have a lot of like small pockets that we give money to. And I think we've gotten to the point, especially on this issue, we really need to start strategically looking at how as a town do we want to take all our piles and say, what is the most effective way that we as a community address these issues and then make an impact instead of here, you do it, you do it, you do it, you do it. Where are we strategically wanting to put our money to most effectively attack the problem? And that's kind of data driven. Everybody's gonna ask for data on who's doing the best work and who's getting the best outcomes.
Yeah, Don, I think that makes tons of sense. And I think these two things can be true, right? This is a big area, but also we just need to be strategic and smart and intentional. So I personally welcome these challenges, and I think they're very, very appropriate. And I know we're, as a commission, going to be very supportive of your thinking on this stuff.
And it seems like that is the approach that brought about the urgent care assessment program, and that's been so successful that maybe, mimicking something like that process I'm talking about, this more specific area of behavioral.
The New Canaan Community Foundation, through the opioid settlement resources, has been approved that they received $25,000 to do a town-wide behavioral health survey. And I think this will be an excellent beginning to see what the environment is for our community, and we can go from there. They did an unbelievable job done, pre-COVID they started, and yes, and the urgent assessment program came out of that. And it was a great model to follow, and maybe that's, this behavioral health assessment survey might be the key to the beginning.
And telemed were both funded by ARPA money. And that, I'm trying to remember, I think the state got $6 billion. Some of that trickled down to the towns, which was good. And the problem is, there's never going to be another ARPA in our lifetime. So we're going to
I
have to
meant
figure out how
more
to pay for it.
that approach of having all of the right people in the room together
The
to talk about
stakeholders, yeah.
with the community foundation and with service providers and, all different kinds of people. That approach seemed to come up with some really good ideas and steps to move forward.
COVID was coincidental with the urgent assessment because what precipitated it was one clinical situation in town for which there was no answer. And that was the impetus. But these situations can arise one after the other. So one was the start, but there were often many. So it's been a great thing. Hopefully it continues and succeeds. Okay, so kids in crisis update. We've heard that a little bit. So going forward, the Board of Finance did not approve the position at Saks. So I think with some background information, so that was one reason we were able to keep our budget to 96,000 for the high school counseling. Hopefully Martha will work out. New business, Freedom of Information Act. How many tuned into that? Or tuned in?
I was there.
I tuned in.
That's right.
It was, so it's Ira Bloom, who's the town attorney. Some of it's common sense, well-defined, others are kind of gray areas, which you need a lawyer and then kind of underline. Let us know that. And when you have this issue, to date, everything we do with Health and Human Services, the commission is fine in terms of our meetings, our agendas, our minutes, our timing. So, so if you're interested, if you haven't looked at it, it's on, I think it's still available on YouTube. And the last item will be, we deferred appointments, did elections, and will be Jim's item on the last item on the agenda. So just go over that again, Jim.
Okay, basically, AARP National runs a national program for giving access several $1 million for things to support the senior world of the country. And we applied last year for our two major innovations, telemed from Waveney and urgent assessment, which is what we want to reapply, take dust off those proposals that now we have another, most importantly, year of operation, and particularly telemed has been very successful, but so is urgent assessment. And again, we want to go back and reapply, and we just need the commission's approval to continue to support these activities. In the case of the urgent assessment, that's sponsored by the town directly and is submitted by the town, and with Mr. Riley being the submitter, as it were, for the town, but it's sponsored by the commission. So I solicit your approval as a commission for reapplying for these grants for the telemed.
What do we think our chances of getting a grant are? Do you have any idea?
I think they're very limited with AARP. The reason I do this strategically is that AARP also talks to a number of national level foundations that have a lot more money and a lot more inclination to support things like this. And my hope is that we're going to triple wire basically and get some attention from one of these groups. The worst case is that we now beginning, and I've talked to Kim and particularly the new person at Waveney, there are a couple of national foundations that specialize in healthcare and are very interested in technology applications. And we are a leading edge operation that will submit the same or some paraphrase of what we're going to send to AARP to these national foundations. As you know, you basically, AARP's goal is to, provide more flower beds and crosswalks for seniors that are safer, et cetera, which is where they spend their money. New Canaan is probably never going to be very competitive for those kinds of grants, but they do have two large grants that are $50,000 and up. That is something we might be able to get. So I have low expectations, but I have an ulterior motive.
Not a reflective, not a reflection on our track.
Well, he was hired, actually, he was hired specifically because he has success with getting AARP grants. Previous life.
Did you get any feedback from AARP as to why did you get the funding?
No. But
Yeah, just always feel like they look at our community and say, wow, you've got a lot of resources.
But in Connecticut, AARP has its own solicitation program. And so I think we'll probably go after that again. But again, those are all small grants.
Right, you're very right, as I recall it.
But you never know who's reading these things. And particularly, again, these are national level opportunities. And we're hoping that, particularly with experience under our belt, and particularly looking at the discussions we've been having, the software that Waveney is using for telemed has a telepsych increment. So there's a exploration there for the future that's very exciting from my standpoint. Anyway, but just right now I solicit your approval as a commission to resubmit AARP National Foundation grants for Waveney telemed and for urgent assessment.
So
I have a motion to approve.
Motion to approve?
Great.
all right.
Conflict of interest.
Well,
Wow.
this may be record time.
Wow.
I'm gonna gonna fill up the last 15 minutes.
Let's
Let's tell jokes.
We didn't have a speaker.
We didn't speak.
That was it.
Hey, you guys, thank you so much for all of this work. Like I know this is not easy. So,
I love doing sheets.
you just, okay.
I'm an economics major, and this is coming through, right?
Oh, she's
Yeah.
Then forget it.
So no, thank you. You're
I
welcome.
accept you.
Yeah.
Come
Yeah,
to
but
mine.
wait a minute, before you said that, did it happen? Did it happen?
You know what?
Reserve mistake.
I didn't know
So
this.
frustrating, it should.
She knows how to use it.
So that's what we can do with our last 15 minutes. We
I'm
can
gonna
check that.
Can I make a motion to,
Oh,
Yes,
yeah.
but not to, I mean, Bethany deserves all the acknowledgement she's getting, but actually to have a meeting when we have Bethany, Tucker Murphy, Deanna Carlson, and Jones.
Sure.
Cheryl Jones.
Yeah.
And I was there just going over all this and have the town people that know exactly where the money's coming from, where it's going, et cetera, and what fits and what doesn't, knowing about his budget. That's why this was as detailed and final as it is finished in an hour.
That must have been
And that
very
initial
difficult.
thank you was to that whole group.
Yeah.
And you too.
Yeah. Must have been challenging.
I didn't see anything in there about the retirement plans for the commission.
And I don't see our team building spa weekend. on
I did read through one of, I read through one of Kevin's books from yesteryear, and he was strongly suggesting that anyone who's been on any commission in town for 10 years or more, it's time to retire. I'm not there yet.
did we get the same pay?
As an
Retirement.
incentive.
Same bottom line.
Okay, let's adjourn the meeting.
Yes.
Motion, you said?
I'm known to make a motion.
What?
He's the quickest.
Do we have
Well,
anyone?
I do want to say Jen Zonas is here.
Hi, Jen.
And so is Janet Fons and Kim Norton.
Hi, Janet and Kim.
They are the town council liaisons. Pardon me?
I don't know.
Jen Zonas. She's the town council.
Hi, Jen.
And so are Janet and Kim.
And Janet and Kim, maybe go through, yeah, your names. Let's do it.
Tom Ferguson.
Jim Lisher,
Laura McIntyre.
Harrison Pierce.
Jen Laddick. Alyssa McKenzie.
Russ Barnsdale.
John Allison.
Everyone knows me, sorry.
You're like Oscar over there.
Jen's excited that we're.
I make a motion to adjourn.
oh, second.
Are we gonna talk about the next meeting dates?
Oh, we could.
Did you get the calendar?
Well, we were discussing, is is there really a need to meet every single month?
You have to go through town and change the bylaws and do everything else. if you want
It's
to do
not
that.
listed in,
No, I thought of that
it's not in the
intermittently.
charter that you have to meet every month.
When you change anything, you have to, there's a formality, there's a process to it. I just can't say, okay, let's.
Do we have a motion on the
Should we
table?
look into it?
Adjourn.
Adjourn.
We adjourn.
Second
Do I
it.
have a second?
Favor?
Okay, the meeting is ending.